to everybody, and welcome to another episode of The Different News. I have a very special guest, Dr. Michael Glogauer from Canada. He is the co founder of Ostia Sciences. Welcome, Dr. Michael, and thank you so much for being on the podcast today and accepting my invite to come on The Different News.
I'm glad to be here and I look forward to an interesting conversation.
Yeah. So, to my audience, well, I have a very interesting thing to talk about today. Dr. Michael has some fantastic innovations in hand, and he has four patents, and he has a lot of peer-reviewed papers published internationally. So, I think, Michael, it will be fantastic to know your journey from you yourself. So, please tell us your fascinating journey, how from dentistry, being a dentist, you became a clinical scientist, and today you are an entrepreneur. So that's an amazing journey, and I think it will be very inspiring to know your journey.
Sure. No, thank you. So I guess at this point I would say, so I'm a clinician scientist. As you mentioned, I'm a dentist. I'm a periodontist. I have a PhD. I'm a full professor at the University of Toronto. I have an active research lab. I'm head of dentistry at University Health Network, which is the number one hospital in Canada. It's been ranked number 3 in North America. Do a lot of heart transplants, but we also have a full functioning dental clinic in order to optimize the health of patients who are going under heart transplants or having cancer therapies, because this hospital has recognized the importance of oral health and the impact it can have on the outcomes of the patients that they're treating. And this sort of fits in with my research interest. I have a very strong interest in trying to understand the impact of oral disease on systemic health, and also trying to understand how we can improve overall health by really focusing on oral health. And maybe later on, I'll get into some really, really exciting research and some discoveries we found on the links between cardiovascular health and periodontal disease. But, so as a start of, I started my career, I was really interested in research, and it was suggested to me that the best way to be the best researcher I could be was to have a clinical training. And I chose dentistry, probably just because it seemed the most opportune, available clinical career available. Then I got a PhD and became a periodontist at the University of Toronto in dual training. Went to Harvard and did a postdoctoral research fellowship in experimental hematology, where I became more aware and trained in innate immune and immunology, and came back to a faculty position at the University of Toronto. I'm also a full functioning periodontist. I have a large periodontal clinic just outside of Toronto, where I do a lot of dental implants, focusing in on periodontal treatment, treating peri-implantitis. So I also have a very constant foot in the clinical world. But I love research. I love the seeking aspect of it. I'm a very curious person, and it really gives me an opportunity. My clinical constant presence in the clinical world, both in the hospital and my clinic, affords me the opportunity to understand what the problems are, and then be able to use my scientific background to try and find solutions. And being an entrepreneur as well, that allows me to translate that into patents and products and startup companies that sort of help us improve on the issues that I'm aware of in the clinical setting.
Amazing. I think it's like what we call as multidisciplinary and interdisciplinary about science. I think your entire career is an living example of that. And thank you, Michael, for sharing that. I think it inspires a lot of people out there, and particularly people like me, hungry for science and knowing all these interdisciplinary areas. Thank you for sharing your journey with us. Well, I think while you were speaking and you're telling your journey, and I also read about some of your innovations, could you tell me about, or tell us, our audience as well, because you are a periodontist, and fantastic thing is that right now you are, I don't know how you juggle, but both clinical and academic, it's I think it's a very tough job. And then that brings me to your latest innovation, which I read is about perio monitor. So
Sure.
can you tell me the background story of it? How exactly this idea came to your mind, and how you translated this into a product for people?
Sure. So when I was doing my postdoc in hematology, experimental hematology, essentially I became a neutrophil expert. So neutrophils are the most numerous white blood cells in circulation. They make up anywhere between 70, sometimes 90% of the white blood cells in circulation. They're the first responders. So they're the first cells that show up when there's been a break in the barrier, the epithelial barrier, at the first sign of infection or damage. These are the first cells that go in there. They're part of the innate immune system. You don't need a previous exposure. They're able to fight bacteria. They're able to clean up infected areas or damaged tissues. And the paradigm or the understanding was these cells only show up in tissues where there's infection or damage. And one of the things that always perplexed me was I became aware that there's this constant influx of neutrophils into the oral cavity. So anybody, if you do a quick rinse and you look at the cells in that rinse, there'll be two cells, epithelial cells that are sloughing, and there'll be neutrophils. And then I became aware that in patients, even in health, there's this low level of neutrophils, but as you go into exacerbating levels or increased levels of periodontal inflammation, there'll be more and more neutrophils. And so it dawned on me that this would be an excellent tool to be able to detect early breakdown of periodontium, early development of inflammation, and you could also use it as a screen for more advanced forms of periodontal disease. And so I've spent probably more than 20 years now developing a well-standardized, quantified rinse that we used on the research side to be able to assess periodontal status in sometimes non-traditional dental settings. So in the hospital setting, we can quantify periodontal inflammation in patients where we can't necessarily go in there and do a full exam because they're either we can't get a periodontist or a dentist in there to do probing. It's not appropriate. And so it became a very important, useful research tool. But then also the idea became that maybe there's clinical advantage to using this kind of test in the dental setting. And so over time, through many trials and tribulations, we were able to finally get it to the market. We've got it through Health Canada, which is very challenging. And so now it's a test that is just started to be sold on the market for dentists and hygienists to be able to use in the clinical setting as part of that initial hygiene or dental examination, being the first thing that happens in the operatory. It has a couple of advantages. One, there's a lot of research that has been shown that patients need to see, when patients can see their test result and participate in the test result, it makes them much more appreciative and more easily to understand the pathogenic process or the disease that they may have, but it also helps them buy into and gain confidence in their clinician. There are a lot of research that has been done on this, and that's what we found with PerioMonitor. And one of the unique things about it is, compared to other tests that have been developed in the dental setting, it's chairside. You get the result within a couple minutes, and it's relatively inexpensive. And that challenge, lots of really good tests for metalloproteinases out there, like IL-8 as an example, collagenase. But the problem is these are more expensive tests, probably in the $60, $70, $80, $100 range. The test we're talking about is in the few dollar range. And that makes a big difference in the ability to be able to use it on every patient as a screening tool, as opposed to selling. The other thing that's really exciting about it is that with the advent and the ubiquitous presence now of dental implants, this test is excellent at detecting early breakdown of or an inflammation around dental implants. So with all on X, with full arch restorations, sometimes you don't want to take off the entire prosthesis. Would be nice to be able to test if there is breakdown or oral inflammation. You can't probe with some of these prostheses. So this test is excellent at detecting early elevations in white blood cell counts in the mouth. So that tells you better get that prosthesis off because there is inflammation developing. So this is sort of the major advantage of this test, and we're getting some really good traction because I think people are starting to understand for a few dollars to be able to get buy-in from the patients, detect breakdown early, to be able to understand that implants may be causing a problem or getting infected. This is where the utility of this type of test becomes quite attractive.
Amazing. I think it's a fantastic product that you have developed over the years. And so just taking a cue from you, like what you were sharing. So does this might also help to predict some way whether, help us understand whether implant would be a failure or not? Because I think peri-implantitis is a very big problem. And if
Sure.
yeah, so I think
Yeah, I mean, one of the interesting things that through my research for the past 10 or 15 years on the implant side of things, what we've been able to glean, and it's really interesting, is that the amount of inflammation. Let me give you a situation where potentially, say somebody has a full stay of 28 teeth. Maybe there's 5 and 6 millimeter pockets around half those teeth. So there's significant inflammation. The elevation in white blood cell count, and that is quite significant. The average count, let's say the average count is about 250,000 of white blood cells in a 30-second rinse. It would be about normal. So in a mouth with significant periodontal, stage 3, stage 4, you could probably get that up to 1 million, 1.5 million. So that's about 4 to 6 times. If you have a patient who has a single implant with peri-implantitis, where the rest of the teeth and everything is pristine, that patient could get 5 to 6 million. So in other words, the amount of inflammation associated with a single implant is probably 3, 4, 5 times as much as half a mouthful of periodontitis. And through our research, it's sort of made me aware. I think the reason for that is that peri-implantitis is 2 inflammatory processes happening simultaneously. And that is, there's certainly sort of a microbiome related inflammatory response. But at the same time, I believe there's a foreign body response that's happening at the same time. And so you've got actually 2 inflammatory responses happening simultaneously, versus in periodontitis, it's more of a biofilm initiated, not so much as there's no foreign body reaction. And that's why you get such a robust inflammatory response associated with peri-implantitis. Now, that's why this test can be so powerful in the implant setting, is that because even at the initiation, during the initial phases of the perimucositis or around the implants, you'll get a significant response, and you can detect that before you start to get breakdown on the bone support, or before it extends further subgingivally. And that's why this test, I think, has, while it's obviously, as a periodontist, it's very useful in terms of managing, detecting periodontitis. I think on the peri-implantitis side, it has huge upside and value.
Right. Thank you, Michael, for actually explaining it in such a comprehensive way, because it's a difficult science, and in a very simple way, you have explained that. Thank you so much for that. Well, if somebody who is, it might be a very layman question. So for somebody who is not familiar about, inflammation, or particularly oral inflammation, so can you tell us that how exactly it affects our overall health beyond, if you're talking beyond mouth, and why somebody should be even, concerned about oral inflammation?
Sure. So, I think let's take a step back, because I think, almost any disease you can think of There's a microbiome component and an immunological inflammation component. And I think the way I sort of describe it to my students is as follows. Mammals are tubes. There's an opening at each end, gums to bums, and essentially lining the inside of that tube. Well, obviously there's an epithelial barrier which lines the entire organism, all of us. And lining the inside of that tube, there's probably 5 to 6 bacterial cells for every cell in the entire body. So that's a significant biomass. In other words, on a cellular basis, we're almost more bacterial than we are mammalian on some level. And health is essentially a symbiotic relationship between that microbiome that lines that tube and our immune system. So there's constant sampling happening between our immune system and that microbiome across that epithelial barrier. There are intraepithelial lymphocytes, there's cells tracking back and forth. And the minute there's a breakdown in that barrier, neutrophils and other inflammatory cells are going to do everything they can to prevent that biomass, that bacterial biomass, from being able to gain access to the body. Now, the only place in the body lining that tube where you have a break in that epithelium naturally is where you've got these dentin and enamel projections that come out of the bone. And so there's a break, and that break, there is sort of this epithelial junction between that epithelial break and that tooth, and there's that adhesive complex. And so the immune system, and neutrophils in particular, are there at that junction, making sure that the biofilm that's trying to sneak its way down between the tooth and the epithelial barrier is kept at bay. Now, the problem is that if we as human beings, if the individual cannot control that microbiome and cannot prevent it from gaining access and getting deeper down and creating a chronic inflammatory response, there will be breakdown, because there's this battle, the immune system and that microbiome. I sort of think of periodontal disease on some level, and this is probably, I may be the only person who thinks about it like this, but essentially, you could make the argument that somebody who cannot keep that barrier intact, the body has a way of sealing that barrier, because the people who don't have constant bacterial damage or risk of it are people who are edentulous. And so on some level, if you cannot keep that barrier clean, if you cannot keep it intact, your body will spit out your teeth after a period, because essentially periodontal disease is a way of sealing off that barrier and protecting the host from the constant ingress of that microbiome into the body. I think one of the issues is we don't think of gingivitis. I think there's this consensus. Oh, patients will come in and they'll say, "How are you doing?" And I'll go, "Great." You'll notice that their gums are bleeding. You say, "Any problems? Does it bleed when you brush your teeth?" Yeah, it bleeds occasionally, but no one really gets very worked up about it. But that inflammatory response is strongly indicating that there's a breakdown, that there's leakage, there's leaky gum, just like there's leaky gut, where the bacteria immune system are having a bit of a battle, and the bacteria may be winning. And there's a breakdown there. And during that breakdown, you're essentially allowing bacteria to gain access to what should be a sterile area, which is the tissues and the circulation. And there's ample research now clearly showing that oral bacteria gaining ingress can be a problem. Maybe I'll tell you about some really phenomenal research that's been done in my lab, which we're just getting ready for publication, which obviously I'm biased, but I really think it's going to change completely the way people think about oral health and systemic health. So I've been particularly interested in how the periodontium and oral inflammation impacts systemic health, in particular cardiovascular health. So University Health Network, they do an incredible number of heart transplants every year. And so in order to study the impact of periodontal disease on cardiovascular health, you cannot really do it effectively by taking healthy people, monitoring their periodontal health, and doing it over 30 years to see just ethically and practically, you can't do it. So I thought that the best way to actually study the impact of periodontal disease on cardiovascular disease to look at patients who need heart transplants. So for a number of reasons, which will come out in the paper, hopefully within 6 to 12 months when you read it, you'll see we've for a number of reasons, we looked at patients who have non-ischemic cardiomyopathy. So most people are familiar with ischemic cardiomyopathy, and that's because you have atherosclerosis, cardiac vessel, which part of the heart will die, and then you will, in the worst case scenario, need a heart transplant because you've lost part of your heart. But non-ischemic cardiomyopathy is heart disease, a heart damage due to almost every other condition. It could be chemotherapy related, medication related, it could be virally induced, any number of, and so it's a catch-all. And what we noticed is that what we did was we looked at all the non-ischemic cardiomyopathy patients, and we collected oral microbiome, periodontal disease status, blood markers. We looked at their immune system in circulation, and we collected the samples before, during, and after their recovery, and we followed them for a year. And what we found is that about a third to 40% of these non-ischemic cardiomyopathy patients, they had a T cell subset, a CD4 positive helper T cell subset that had the machinery of a cytotoxic T cell. And there were maybe 10, 15 papers in the literature about these patients, about this population, and they seem to be associated with patients with sort of inflammatory mediated diseases, including cardiovascular disease, including rheumatoid arthritis, including some viral infections. But the source of them and what was involved in their generation was not clear. What we noticed was that the patients who had these T cells, they also had periodontal disease, right? So they also had significant periodontal disease. And I think we're one of the few to sort of notice that because, as I mentioned, University of Health Network, we do dental exams on these patients, we clear them. We also looked at their microbiome. These patients also had high porphyromonas gingivalis, which was interesting, versus the patients who didn't have these T cells, didn't have these issues. We then went into a group of patients who had type 3 and type 4 periodontal disease, and we noticed about 30 to 40% of them also had these T cells. So independent of the cardiovascular disease patients, also had P. gingivalis as an example. And so what we did was we said, well, maybe P. gingivalis has something to do with the generation of these T cells. And that's exactly what happened. In vitro, in the Petri dish, you take healthy T cells, you put them in, bingo. We took the supernatant for the P. gingivalis. P. gingivalis was making something. To make a long story short, we actually showed exactly there was actually a short chain fatty acid specific to P. gingivalis. That was inducing it. We could take that short chain fatty acid independent. We could buy it, dump it on to the T cells. They would turn into these T cells. So we did biopsies, gingival biopsies. These T cells were being generated in the periodontium. And to make a long story short, we found that in the dysbiotic biofilm, another bacteria called Streptococcus sanguis was making a protein that had not been described before. And there was an epitope or an antigen on it that was 70% homologous to a protein expressed in the heart. And what we've been able to show is that to make a long story short, these T cells are being generated in the periodontium by a dysbiotic biofilm through a short chain fatty acid that's being produced. They're training against an antigen present in that biofilm. They go back into circulation, they're circulating around, and any of them that end up in the heart, they think they're attacking that short chain. They think they're attacking that protein in the gums, but they're actually attacking myosin heavy chain 6 present in the heart. And this is very similar to, it's molecular mimicry. Other dental disease that essentially is molecular mimicry that dentists should know about is rheumatic fever. And that's where you get these T cells that are CD4 positive in rheumatic fever that are trained against the streptococcal produced protein. in that sore throat. They end up in the heart, attacking the heart vessels, and that's exactly the blood vessels, and that's exactly what's happening. So again, there are a number of other factors which I won't get into from an immunological standpoint, but we are able to show definitively that in a subset of patients, their heart disease, is perhaps the most critical part, is that these patients who are getting their heart transplanted, who have these T cells, 40% of them are dead within 90 days post-transplant. If they do not have it, 100% of them are alive at 1 year. So it's the source of their original non-ischemic cardiomyopathy, and it's impacting their survival post-heart transplant. So this is affecting their periodontal disease, and their dysbiotic biofilm is actually the driving factor that's leading to them not their disease in the first place, but also to them not surviving their heart transplant. So, when I was talking to the cardiologist and we sort of were telling them this data, I think there was this realization that there's that this is a sort of an unappreciated issue, because most of these patients are being told, heart transplant patients are told not to see a dentist for a year after their heart transplant. And that may be counterproductive.
I think it's just blown my mind what you said. And of course, when your paper of this study is published, it will be a fantastic contribution to science. And definitely, I'll be waiting, and like many others who follow you. Thank you, Michael. I don't know, I mean, it's so fascinating. And the things that you are telling, it comes as a visuals when you are telling, because it is such an important information that you have discovered through your research. And I think this correlations needs to be talked about, and people, not only I'm talking about public layman, but I think then as dentists, clinical dentists are also not much aware of these things. So I think it's amazing work that you are doing. Thank you so much. So so how do you see perio monitor changing everyday dental visits? Like I'm just taking it to the clinical aspect, because like we started our conversation there. So does it actually makes easier for the things easier for the clinic, for the dentist to say?
So I would say yes. I mean, my vision for it, and what the algorithm, I think the clinical algorithm, the practice algorithm, that sort of downstream of it is that, the patient comes and sits in the chair, and the test is a great starting point to tell, essentially, there are 4 levels. It gives you an idea of what I call the oral inflammatory load, or how much inflammation is present in that patient's mouth. And, the first 2 levels are health associated, and the higher 2 levels are disease associated. And what it tells both the clinician and the patient where that patient is right now. And also, if it's been done over time, where that patient is, the patient in that sweet spot that they've always been, that they're generally in the healthy zone, or are they in the disease zone? Now, that disease zone, whether it's the second highest or the highest level, can give some insight as to what's going on. It also prompts the clinician and also helps the patient understand why there needs to be a periodontal probing. Right? When you're in that disease zone, the test says there's a problem here. You need to find out where the problem is. And I think, dental probing is, a lot of patients don't like it, understandably. And as a result, a lot of clinicians are sometimes hesitant to spend the time. They've got to poke the patients. The patients may not obviously appreciate it. No one wants to create discomfort. Nobody wants to do what patients don't want them to do. But it's a force multiplier. It helps them all understand why this needs to be done, because you've got to sort out what is the source of the infection. So that's number one. It also is, when we've been using it now for a few years, is that patients come in looking forward to it, because we all like to have measures. We all want to know where we stand. How has my hygiene been? How is my periodontal health? And when they understand the impact that oral inflammation or oral health can have, it's also, they want to know exactly how healthy they are, and they're impacting their systemic health. I think, systemic health is such an important, overall health is now really taking off, whether it's probiotics, prebiotics, postbiotics, whether it's, all these various shakes and drinks and all these health associated approaches. Health is now really at the forefront of everyone's mind. And it's a great opportunity for us in dentistry to sort of make sure people understand that your oral health is as critically important as anything else in terms of maintaining your overall health. And this is a good segue or initiative to help us get patients on board from the oral health standpoint.
Yeah, absolutely. And I think, as you rightly said, that when for a clinicians, our patients are most important. So we cannot actually displease a patient and do something, even if it is, we know as a clinician is very important. So tools and techniques like perio-monitor will be a groundbreaking thing. And it definitely also helps the patients to, as you rightly said in the beginning, to gain trust on the clinician, because that is most important. Because as we all know that, and we are taught that 50% work is done when we gain the patient's trust. So that's very important for the treatment as well as the follow-up things. So, and thank you, Michael, for bringing up that prebiotics, probiotics thing, because I think Ostia Sciences also explores in this area. So can you tell us that how these, what exactly we are doing in Ostia Sciences in terms of microbes, and can you just tell us about that? Yeah.
So Ostia Science is a company that I co-founded about 6 years ago. And I would say our goal is to really enter the area of using bugs as drugs, right? And so we spend time essentially taking people who have super healthy mouths, as an example, or super healthy skin, or we also isolate from healthy breast milk. But what we do is we look for specific health associated bacteria that produce molecules that help shape and trim and maintain a healthy microbiome. So our first product is in the oral microbiome realm, which, based on everything you've talked about, you understand why I'm particularly interested in the oral microbiome. And what we've done is we found a strain of Strep salivarius, which is a common oral commensal bacteria. In fact, there are other strains of Strep salivarius that have been used as probiotics. But the one that we found is particularly unique in that it produces a family of molecules called lantibiotics. So lantibiotics are, think of them as antibiotics or produced by Strep salivarius. And we found the first one family that are phosphorylated. In fact, that's what our patent is on. And what we found is, in fact, phosphorylated antibiotics had never been discovered before. And what we've shown is that phosphorylation actually makes it immunomodulatory. And so let me give you some examples. So the antibiotics that we found produced by our Strep salivarius strain called Sali-10, it has this remarkable ability to just target pathogens while maintaining the commensals. So it doesn't kill commensals, but it's able to kill both gram-positive and gram-negative pathogens, which is a very unique feature. And in fact, it does not only the periodontal pathogens, but it also does respiratory pathogens that are actually many of them antibiotic resistant, that cause pneumonia. So we'll leave the pneumonia aspect off on the side for a second. But so what we're able to do is it does an excellent job on really targeting bad elements within the microbiome. So it's very good at managing oral dysbiosis. But what we were able to show is that the phosphorylation group, so if a normal neutrophil, these primary responders that I talked about, are able to, let's say the average one is able to eat 3 bacterium before it succumbs, before it's filled. What we're able to show is that when it gets the phosphorylated peptide, it can eat 6 to 10 bacteria, which is quite remarkable. In other words, it boosts the ability of that neutrophil to eat more bacteria, and they actually are able to move faster. So that means when you're getting an infection or a breakdown within the periodontium, the neutrophils will come there faster, deal with more bacteria per neutrophil. So you need less neutrophils coming in. And so you actually get a dampened inflammatory. The trigger towards inflammation is reduced because you need less neutrophils coming into the area. And part of inflammation is an overexuberant response because you're getting too many neutrophils coming in. And so we're able to show that this does an amazing job at dealing with the pathogens just from an antibacterial standpoint, but also optimizing the inflammatory response. So I really feel this is it's a unicorn type probiotic. And we're very excited. Our preliminary human data looks remarkable. We're about to publish it. We've got a number of clinical trials that are going on in specific patient populations. And one of my goals long-term is to actually my next step, once I get this paper published on the cardiovascular disease patients, is to actually use these lozenges in patients who are quite sick with non-ischemic cardiomyopathy to see if these lozenges, just on their own by reducing the periodontal inflammation and infection, by getting rid of the dysbiosis, can be enough to improve the outcome for these patients, as I mentioned, who are quite at high risk of failure. So, that's a short synopsis on why we're so excited about this bacteria. We're doing 4 clinical trials this summer that are being initiated. One on an experimental gingivitis to show how it manages oral inflammation. We've also, in our first beta trial on humans, there was this amazing feature which we didn't expect, which was no morning breath. People were waking up on just one lozenge, taking it before they went to bed, with no bad breath in the morning. So it's probably, that's probably more exciting on the business side than any of the health things. But so we're doing a bunch of trials on that, and we're also using it in patients who have head and neck. We're going for head and neck radiation. Periodontal disease and decay are quite debilitating in these patients and actually lead them to increased risks of losing their jaws if they get periodontal disease or decay. So there's also a 3-year trial we're doing in that population at Princess Margaret Cancer Center in Toronto to show whether that can actually reduce the negative outcomes in these patients just by taking the lozenge.
The lozenges that you're talking about, are they in the in the market, or we are still?
So great question. So most people may find this surprising. I know I did. The most difficult country in the world to get a probiotic on the market, because you need a Health Canada or government approval, is actually Canada. So in Canada, so I guess we're a Canadian-centric company. We figure with all the hurdles we're going to have to jump through in the regulatory, and our clinical trial will be done in October, we figure that we will be on the market in Canada by the end of the first quarter, so about March, April 2026. However, I mean, maybe I don't know what the regulations are in India, for example, to get a probiotic on the market. But I think we're sort of focusing on our clinical trials, but certainly we'd be looking for partnerships and anybody in various countries around the world where they would value this type of non-invasive, inexpensive tool that can just rapidly improve oral health outcomes and everything downstream of that. We'd certainly be interested in talking to people.
Yeah, I think it's a game changer, and I'm sure with time, as the time goes, and the way you are dedicatedly taking things forward, your global approach is just a matter of time. So
Right.
thank you, Michael. I think it was amazing talking to you today. And before we go, if there is any message that you would like to tell to people.
Sure. I mean, I think, for those in the, young people who are coming through, I think, marrying clinical interests
Hmm.
with scientific interests and entrepreneurial,
Yeah.
I've enjoyed it tremendously. I think, I'm super excited to get up every day and move my ideas and insights and the things that we come up with in the lab to the next level. It's been an incredibly rewarding and very, very interesting career. And I would also say, for those of us who are toiling in the oral health realm, I think that, the importance of what we do, obviously, we know it's important, but I
Hmm.
would say just around the corner, I think our medical colleagues and the population in general will very soon start to appreciate as much as we do how important oral health is.
Exactly.
And that will, allow us to make even more of a difference because when people are coming to us,
Hmm.
asking important questions and recognizing how important oral health is to their overall well-being, it will make our jobs easier and even more rewarding.
Yeah, definitely. Thank you, Michael, so much. And it was amazing talking to you. And I'm sure this particular episode is filled with so much of, science innovations and new information for everybody. I think it's a gold mine of knowledge that we have gathered through this podcast episode. Thank you once again for being here. And it was fantastic conversation with you. And I hope that we catch up again for more such insightful conversations in the near future.
Thank you so much. I appreciate it.
Thank you, everybody. Keep following my channel, and please subscribe to different news to learn more about such amazing sciences that how experts like Dr. Michael are doing at different parts of the world. And I'll bring more experts like this and give you food for thought for the whole year or day. Thank you so much.